Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you.
On these knees, and I've been doing the exercise you told me.
Squats?
Yes.
You can tell the difference here.
Oh, really? Is it loosening up?
Yeah.
Okay, good.
It just takes a while because, see, it's down here all the way down.
Okay.
The tendon right in here. It's not your knee. Your knee's back here.
I know. You told me that before, so.
Yeah.
All right. And then, like I told you, my husband's goes like this. Mine doesn't move.
I know. That's the idea. We're trying to get it to look.
I know. He says, ask him, is this right? I says, I think it is.
Yeah, that's a scar tissue. Go ahead and lay down.
So maybe what you thought earlier.
Could you move it?
Relax here. Yeah, I got under that one pretty good.
He's killing me here.
Yeah, well. This is not heaven on earth yet. All right, skedaddle.
All right. Listen. You can have lunch tonight if nobody else
Hold on. It's right in here. Here or here?
Well, I don't know. It seems like it's a whole knee.
Well, tell me where it's worse.
Okay.
Here, here, or here, or here.
No,
It won't be up there. It'll be down here.
It seems like probably right in there.
Right
and
there.
I noticed that yesterday
Yeah, you see this
I would
little
have.
bubble? See this little bubble here? It's because it's overstretched.
Because it would sting real bad right in there last night.
Stinging, huh?
Yes, just
Stinging.
yeah, it was just like a bee sting almost. You know.
Okay, lay down.
Well, after you've been hurting for about 2 years, so you just kind of forget where it does hurt at. Yeah, I heard your radio show and I listened to it again yesterday.
Pinch, pinch.
Oh, gosh, whew. Oh. Oh.
Now this is the result of a surgery on the knee, a knee replacement. First of all, the pain is not in the knee, there is no knee. So it's how they approach the surgery. They cut right into the front, put the patella way off to the side, and then they have to bring it back and sew it in. That means scar tissue underneath it.
Yeah, that's scar.
And so when you think that you're going to get it over with, you're going to say, oh, well, I'm going to get my knee operated and never come back. That is not true. It comes back all the time. And it comes back because of scar tissue. So my advice to anybody listening, don't get your knee operated. There's all kinds of treatments for these. You don't need to get them operated, right?
You're right, because I've been suffering with this for 2 years now, you know, but now I want to know too, is what about my left knee? Is it?
Left knee, I don't think there's anything wrong with it.
Okay, that's, see?
No, there's nothing wrong with it.
Okay,
Your knee is back here. Your knee is back here.
I don't have any trouble with it.
No, well then don't look for trouble.
But see, they told me that after I'd had to get this one operated on, and they was gonna do the other one at the same time.
Jeez.
Yeah,
He was gonna
well,
operate on it
but
again.
don't go back to that guy.
Well, I
Don't
won't
ever go
tell-
back to that.
I'm not going to.
He's not thinking for you, he's thinking for himself. So, anyway.
No, I was
that is-
impressed because I, you know, since you did it last Monday, I've just been so much better. You know, I've suffered with this for about 2 years.
Why did you go back to the doctor who did this and say my knee's hurting you?
Well,
What did he say?
I had it done up in Indiana.
What did he say?
Well, he said I had scar tissue, and that they'd had to go in and take the scar tissue out of my
No,
leg.
another surgery causes more scar tissue.
Yeah, yeah.
Self-serving, yeah, no, that, they're not, they don't know how to treat this. All they know is surgery, see, we treat this, so. Anyway, so we can treat it, but why do it in the first place? Don't do it. All right, kiddo, do your squats. Stretch it out, you know, hold on to something when you do it.
Well, I'm in an exercise class too that I do for an hour 3 times a week.
You do what I tell you, I don't know what they're telling you, you do what I tell you.
Well,
Squats.
this okay,
Is what I want.
okay.
All right, all right. You're looking at your face.
Okay,
Anyway,
good.
it's gorgeous
Good,
the way it
good,
is. You
good.
don't have to worry about it. So what am I doing for you? The knee?
The knee, this is my 4th treatment, and you Saved by the Bell, and you
You like it?
said, well, I think it's helped. So
All right, now this, unfortunately, she has a deformity. Not bad, but, so this
A
is
deviation.
This is the, that's a good word, deviation.
that's what they call it.
This is a pretty straight knee, but this one isn't, and you can actually see that. So, as a teaching film, this is what we're doing here. This means that there is a scar tissue along the outside of the knee, not inside. So nothing happens to the inside, it's all on the outside. And if you can look over there at that blue, don't drop, you don't have to move the whole camera.
It's because the paper's curled. I want to tape it down.
Paper is curled?
Yeah.
Yeah, so the difficulty in the knee, it's not the knee actually, it's the blue that goes around. It's a ligament structure that holds the knees together, holds the bones together. The what bone is this? Femur and the tibia.
Yeah.
And the fibula. And it holds all those together and makes a joint. And every joint has that around it. Every joint, fingers, shoulders, everything has the same tissue around it. And so this is scar tissue right here. So this was an injury. How'd you hurt this?
You know, I was playing singles tennis, and I reached for a ball, but I think it'd been coming on for a while. Could be wear and tear from old age.
Yeah, is this improving at all?
I think it's a little better since you started doing it, because and I kind of wonder, we're getting into autumn, so less humidity, so if there is some arthritis, even though they claim I have arthritis.
Well, that's just a general term. Arthritis
Yeah, I
doesn't
know.
mean anything. I wish they'd stop using that term.
Oh, there it is. You just got it
Do you
right.
still play tennis?
Right here.
Yeah, oh yeah.
Yeah, there it is right there.
This means it's gonna hurt like hell when he marks a spot.
It's all in your mind.
You can edit out.
I don't hurt you. You know that.
I mean, the concept of lidocaine. Not quite.
You're a good sport.
I'm not.
It's only for 3 to 5 seconds.
I know. He keeps telling me that the time is relative. Einstein had it.
True.
We gotta give her a candy bar or something to eat while we're doing it.
Hey, do you watch any of the tennis on the tennis channel?
This is a half-inch, no, it's 1-inch needle. It does not go inside the knee at all. This is all peripheral.
Are you done?
Yes.
Done.
You know what? I gotta tell you, I was overreacting because normally I'm lying on my side and it hurts exponentially more. It hurts, but this, I think I like this position. That doesn't sound good, does it? But, you know,
So you were acting for the camera, you mean?
no, sadly.
Actually, this is improving now, because I can actually feel the space in here.
Yeah, I think-
Now, before there was no space, see?
Well, you know
That's
what?
why you had to go on your side, I had to stretch it out.
Okay.
But it's all technique, but yeah. Yeah, this is really doing good. There is no, we'll just wait until you get relief here. There is no reason to operate a knee like this. And the reason is that you're only talking about 2 inches or 3 inches of scar tissue, that's all. And that does not affect the inside of the knee, so you'd never want to replace the knee for this.
They've tried though.
They tried to get you to do it.
Yeah, they said, well, when the pain really becomes excruciating, get the knee replacement.
You see, that's unethical. That's an unethical doctor. You're not supposed to talk like that. You're supposed to treat the thing. Not say, well, you go off, when it's too bad, just come and see me. That's baloney. You don't talk like that.
Yeah.
2 of them did that.
And
they gotta stop
well-regarded people
doing
in
it.
their
It's
field.
unethical treatment of you. And that's not fair to you. It should not happen like that.
Restroom?
But,
So we keep on doing this?
yes,
you know,
gradually open up.
you know?
I need to get a Band-Aid for you. Don't move.
Oh, don't worry about it, I don't
Oh,
care,
yeah, I
a little
worry.
blood. My days of playing with the boys are over.
No. You still want to play with the boys, don't you?
No, I don't.
Not golf or anything.
No, tennis.
There are other things.
Oh, God.
No, don't leave yet.
What do you mean, no? I'm sorry.
Now, to finish the teaching on this,
I'm sorry.
this is called a valgus knee because it veers laterally out this way. The bow-legged knee, varus knee, V-A-R-U-S, would go the other way. In other words, you'd have a bow-legged. So this is the opposite of varus.
So it's a valgus.
So the Cowboys have a varus knee. This is not knee, the other one isn't, because it's
But then, how did this happen? Because I used to have,
just an injury, that's all.
you know what? I used to have the dimensions of a rocket. I swear to God,
Yeah,
kidding.
you still.
And all of a sudden, what happened? It was veering off.
Right, yeah.
But
That's a really a terrible injury. And I checked your hip, I think.
Yes.
Yeah, have a seat right here. Have a seat.
Can you extend your leg again? I just want to see how good it is. Okay.
I don't know if that's improved already. It
You know
probably
what?
is improved.
you know what? I'm telling you, it has.
It looks like it's a little straighter than it was.
Tell the camera.
It's a little straighter. I mean, a lot straighter.
It is improving. It's incremental, though. It's not a big thing like one day and you're straight. No, it doesn't work that way. These are deep, important ligaments that hold these bones together, and it's really scar tissue, and you got to just work with it. And it's deep. It's about 1.5 millimeters deep, and it's right under your right under the skin. You see, you're feeling it right now. That's the ligament,
Okay.
the blue, and. I want to see that.
Don't
Just
hurt it.
relax now.
I'm so happy it's not paining me. But you might do something else.
I'm looking. I'm looking for. I got to do your knee, your hip, eventually. I don't know. Kind of pretty good. All right, that's it.
Thank you.
Everything is treatable. Not by acupuncture either. He's waiting for you to come back for surgery, is what he's doing. Did you refuse surgery from him?
Yeah, so
Okay,
far.
well, now you know why. Now, he's not going to do anything for you until you suffer and you can't stand it anymore, then you're going to ask for the surgery. And when it doesn't turn out good, he said, well, you wanted it. That's the game they play, so don't go back.
Well,
All right, what kind of trouble you having?
well, what happened was I fell in my house. I slipped and I fell back. And it wasn't here, okay? But now it's about right in here at the side.
I got it. Where does it go?
Huh?
Where does it go? Does it go in the leg?
It goes straight down my leg.
Down the back?
And it hurts in here.
Does it go down the back of your leg or the side?
Front.
This is the front.
Right.
Does it go in the front? Really? How old is this pain?
Couple months.
Couple months.
And then I thought of you. And I said, you know, maybe I'll come down here and give us a try.
Oh, it's a slam dunk.
Really?
Anything wake you up at night?
Anything waking me up?
Yeah.
What do you mean?
You sleep all night or does something wake you up?
I don't sleep very good.
From this?
Right. It hurts too bad. I mean, this thing, I mean, it's 24/7.
Does it bother you walking?
Oh, does it bother me walking? I can't walk.
I asked you first.
I can't walk.
That's you first.
I can't walk.
What happens when you walk? It starts hurting you.
I drag a leg basically.
Yeah. And your back doesn't hurt though, does it?
No, that's the funny thing. They said it's coming from my back.
No, it isn't.
Huh?
No. You had an MRI, didn't you?
Right. And the doctor said, your back is shot. That's what he told me. I swear, that's what he said. Exact words. Your back is shot. You got 7 bad vertebrae.
Can you believe this?
I believe him, I just can't believe it. That's,
I know that's what they told you, but they're scaring you to death. So,
Right.
So you can get operated. That's what that's the whole game.
Well, I'm not sticking needles in my leg.
Acupuncture is a scam. There's no reason to do that. So glad you came because we're going to fix this right now. So what do you think he has? So
You're
far?
kidding.
No.
You think you can fix it?
Why would I kid you? Sit back. You're not better. Just relax
the
now.
right leg.
Oh,
And that's good. Yeah, bring your knee up, straight up. Hold it up, up. Can you do that?
barely.
You can't do that. Huh? How about this one? Hold it up.
You couldn't
Hold it up.
put it. Hold it up, they don't let
Are
them
you
press
all
it
right?
down.
Hold it up. Yeah, hold this one up. Does it hurt?
Yeah.
It hurts when you do that, right? Okay, now I'm going to examine
It hurts when I think.
Then don't think. All right, I'm going to examine your hip now. Does that hurt it?
A little bit.
And this is good. That's good.
I got my blood results back. I'm like a 20-year-old, you know.
Well,
My
my
blood
with your
results.
blood. This is a tendon. Hold this up again.
I know, but I'm in too good a shape.
Shh. Bring this up. Your knee. Hold it up. Hold it up. Does that hurt?
Hello?
Who's that?
I don't know.
That's never happened before, when somebody lifted their leg.
Hello? Who is this? Where is it? Hello?
Strangest thing.
Yes, hi Jim. Did you call me?
Who is this?
Mariana.
No, I didn't call you. In fact, I'll never call you again.
This happens a lot when you're sitting there and you move a certain way and it dials the phone for you.
I don't know.
Okay.
Phone is. There it is.
What? Your phone?
It's in your other pocket.
Listen, that girl came over for the hurricane. I only met her twice before. She didn't know where to go.
And she's.
I live in Marisol, and
You live in where?
Marisol, nice place, off PGA.
Oh.
And she says, can I go get some cigarettes? I said, I doubt if anything's open. They're setting our windows out there. Dumbass. Anyway, she takes my car. She wrecks. And I have no rear mirror when she comes back. And I have a Jaguar. And now the guy is suing me for injuries.
Jeez.
I can't hear you. I don't have reception where I am.
That's because you don't know what you're doing.
Okay.
I didn't call you. My back did. Bye.
You know this girl? Huh?
Barely.
Barely.
Just well enough to get sued, huh?
Yeah, well.
I called the police on her, get her out of your house, stand right there,
So,
stand here, face that wall,
so the police,
turn around,
she was suspended license.
turn around.
Where am I going?
You're coming right back.
Facing the
Where
wall.
you going? Where are you going? Here.
Oh,
All right, bend forward now. No, don't do that. Just bend from the waist. Bend from the waist.
oh,
Bend.
Try to touch
bend.
your toes.
Don't touch anything.
oh,
Does that hurt you anywhere?
oh, yeah,
Okay, come back up. No, bend back up. Bend back towards me. Bend back. Over my hand. Bend back. That's good. Go left. Go left. And to the right. Right. Normal back.
normal. There's nothing normal about this body.
Have you been drinking?
No, I don't drink.
You sure? You act like you're drinking. Are you taking drugs? No.
I couldn't sleep last night. I'm a little giddy.
Oh, okay. All right, you have it looks to me like you have a tendon right here.
Tendon.
Tendon. Your back is good, so I'll just put a shot in it and it'll go right out.
Come on, can't be that easy.
It's not easy. What do you think? What do you think I'm doing here? I'm calculating, I'm examining you. I took a history.
You'd be Einstein if you could do that.
That was very close.
We're gonna do it right now. You say so.
Are you the guys that are brothers? Or,
Brothers? Yeah, we're brothers.
no. I see a TV show out there. You don't look like the other guy.
Does the other guy look like bald?
I don't know.
Yeah,
No.
right here.
Okay, this
Who's
is
the brother you have out there on TV?
my brother.
Or who's your partner?
Freddie.
Ready?
Freddie and Les. Those are two guys. And him, he was on the film crew.
Well, you all have some miracle drug or something.
No, it's a location, it's a diagnosis.
What do you put in there?
Just a steroid is something to fix it, clear it up.
You mean, I just don't quite understand this.
It's hard to
I've
come
been to
in.
5 doctors, and they all told me,
Okay, then that's your answer. They're all surgeons, they all want to operate you. That's the bottom line, don't you understand?
they say it can't be fixed.
Oh, that's not true.
That's what they tell me.
Nobody
Well,
told me.
that's BS.
They said there's nothing you can do about
Yeah, they
science.
said there's nothing you could do without the surgery. You missed the coda, the end of it.
Yeah.
Yeah, you missed the end of it. So you already remembered what you wanted to remember. You gotta remember, these people aren't in business to sell you insurance policies, you know, they're in business to operate you. So anyway, you have a hip flexor tendon there. You want me to take it out right now?
Yeah.
Yeah. It's a shot. And it's right here.
No,
Yeah.
it's back here.
What? No, it isn't. Hello?
We confused.
Don't tell me what it is. Just take your treatment and be quiet. And make sure you pay your bill.
Okay.
That's all you gotta do.
How are
Is
you?
that it?
I was good until he showed up.
Like to
All right, come on. You wanna get this done or not?
Yeah, man.
I'm balancing it out.
I gotta talk about him on the radio show because this is typical. He goes to 5 doctors, all the same thing, and wonders why he gets the same answer on it.
Yeah.
Favor. You need someone to take care of you, my friend.
You ought to see what
Bring
I
his pants down.
You ought to see what I got taken care of, man. Doc, you know, I retired, right?
You did? For what?
Well,
Hold us up.
I'm tired of the furniture business.
Were you naked it or something?
No, I ran Badcock furniture stores.
You did what?
I ran Badcock furniture stores.
Babcock.
Yeah.
No kidding.
You ever heard of them?
Yeah.
Oh yeah, it's a strange name though.
Yeah, well, that's my grandfather's name. Anyway, so I quit, right? So I went down to the casino and I won $1 million.
No kidding.
I mean, really. Who does that?
You have achieved the dream of all of us.
Do you know that nobody has ever done that?
So what did you do? Take your $1 million and retire?
No, I got it up to $1.8 million.
Oh.
And
Good for you.
I lost 500 and I lost another 100. I don't know. I think I'm up 1.2 for the year. But and now they tell me I gotta pay taxes on it.
Oh, yes.
Yeah, well they don't send 1099s out.
Giving it away. You don't make an investment. There's no return on it. Oh, that's what they do. They flood the language so you can't even understand what they're talking about. Say, what is she talking about?
Oh.
You can't tell.
Oh my God.
Well, once in a while she lets it loose and then you can figure it out.
I'll tell you one thing. She just snakes over.
You're done.
You know what?
Get out of there. You're done.
How can I be done? I was having a good time talking to you.
He wants to stay here all night.
Yeah. So I can play golf again?
No. You can't play golf. You can't play the piano. The harp is out. Those things you can't.
Because you
do.
couldn't play them in the first place.
Yeah, that's the inside joke of it.
No, I was told I won't be able to play golf for a long time.
Play tomorrow.
You're kidding.
No, you get to the right spot, you're going to be moving fine.
Doc, you're my Beethoven.
Do you feel any difference? I mean, it could take up to 5 minutes.
5 minutes.
You know, it sounds crazy, but he's done. Look at, you can say it now.
If this works, which they say it will, then it's the most fascinating thing I've ever been through. I would have bet that I'd have been in a wheelchair in 5 years. I was led to believe that it was operation or you're finished for life. I was told that my back was shot. I had 7 bad vertebrae. And he sent me to a physical therapist. Was like sending me to, having cornflakes for breakfast. I mean, it was a joke. And an acupuncturist, he put 4 needles in my arm and they weren't there when I woke up. And he said, I'm really coming along good. I said, Doc, you didn't do anything. And I don't know what the hell you're talking about. So, and now I was supposed to go to a pain clinic, not to get pain medicine, but to get injections of some type.
Epidurals.
I don't know, am I still supposed to do that or am I? It's a cross between Einstein and
Father Teresa.
and my doctor.
Listen, you can't convince me. Keep telling me how great I am.
Well, what I'm saying, I just don't know how you can have so many diagnoses.
it depends on who you go to. If you go to a surgeon, you get a surgical diagnosis.
When I knew this guy when I was 6 years old, I told
Yes, but they did. And you went to 5 times.
yeah.
Better late than never.
The right knee it is.
Right here it is. I did, like I said, I did a surgery about 2 years ago, a year and a half. And, you know, this left knee is strong, can go up and down. Right knee, that's so much I can go down. I play a lot of tennis, so that doesn't help much either, but I want to play without pain. Is that possible?
Yeah.
See if I can pull this up. He's kind of swallowing, you know, he swallows.
See that? No, this is normal.
This one gets a lot of water, he'll swallow here sometimes.
It's a normal knee. Where is it bothering you?
When they walk,
No, where?
right here.
Oh, right there. Oh, it's patella. Kneecap. Try this one. Yeah, this one's good. Try this one. You got scar tissue here. That's why you can't squat. Where did they go in at?
They did one is
Right into
here,
here,
one
right?
here, one here. That was
Okay,
three.
this is why you have the scar tissue here. This is scar tissue under the kneecap.
He's giving this pain every time I try
All
to
that pain
squat.
is from there. Your knee is normal. Your knee is down here.
When I try to move, it hurts me. If I go up in the truck, hurts me. It's like, you know, if I play my tennis,
What's your rating? Do you have a rating?
I probably 4.55.
Good.
You know how fanatic we are. Right?
Yes, I do. Where do you live?
I live in Deerfield.
How close is that to West?
I play a lot Mission Bay. You know Mission Bay?
Oh, it's gorgeous over there.
I play those sports.
That's 441. It's just a different world, I think.
How far is that from West Palm? A long distance?
Distance, yeah. Yeah, about 40 minutes maybe.
Oh, that's not that
Not
bad.
bad, no.
'Cause
That's what I'm doing.
Okay, now to treat this, it requires shots because we have to dissolve the scar tissue. Also, you should be doing more squats, not less. In other
I
words,
was not doing much because the pain.
that's right.
Don't let me do
Don't
it.
let the pain stop you. When
Okay.
you have a pain doing squats, you do more.
Mm,
You gotta loosen it up. Now, we'll loosen it up with the steroids we give you,
okay,
but you actually have to do the work on that.
do the work on that, right? So how much that hurts? Those shots.
Yeah, that's not gonna hurt that, it's all you're lacking here. So when you do things, you're pulling on scar tissue,
Mm-hmm.
and it tells you there's something wrong, but there isn't. It's just scar tissue under here.
Um,
Due to the fact they went in with a big needle, a big opening, see? That's why they keep doing those surgeries, I have no idea. There's no advantage to it, no pinch.
But it's okay for him to hit on a hard court, right? And not just hit on
Should
clay.
do more, not less. No wonder my hands are hurting at night. The big lugs like you. Jeez.
and they told me I have ACL. They want to go in and take my I think they call it replacement ACL, right, doctor?
Yeah.
Something like that.
I
I
wouldn't
said
do it.
no, it's too much, you know.
Here's the problem with any surgery.
We play some court every Saturday, so he told me you gotta go there.
The how you have to think about this, if you let the pain let you think in reverse, you get worse.
That's what I was doing.
That's what you're doing. So what you have to change, you have to say, well, it's just scar tissue, that big, stretch it out.
And I was using this one most of the time, working with this leg,
Yeah, well, let's
You
see
know,
if you
play
can
with this
squat
guy.
now. You weighten this up again.
and that's what I was doing. I was not using
I should
the right one.
get a Band-Aid if I wasn't so lazy.
I'll look at it.
Lazy, stand
That's
up.
okay. Should be go. I gotta go back to work anyway.
Yeah,
So.
go ahead and squat.
You sure?
Yeah, hold on to the table. It's like magic. Look at that, did you see that?
I could see what he couldn't do before.
like
he-
magic.
I wasn't doing much at all. I wasn't doing.
Can you do it one leg like you trained to do before?
That I can do with this one. This one, I don't know.
Don't be afraid.
Hang on to the table so you do it safely.
Yeah,
Yeah, you're afraid of it a little bit, but you did well with the before. With
both
the
of
two.
them, yeah.
Yeah.
You know,
Yeah, do it more. See if you can get all the way down.
with one is still a little.
Yeah, do it with
Do
two.
both.
That's it. Look at that.
With both I can do it, but one,
Look at that.
no. You know.
All right.
So hope this will help.
I saved you a big surgery. ACL doesn't even exist. They're lying to
Why
you.
do they talk about that?
Because they lie.
Because they can get paid that way.
Dr. Pannozzo.
Then hook out for 2 or 3 months.
Well, how'd you get this?
It happened today.
Today.
I was outside at the back. I wasn't doing any work, nothing. It just came on.
Months, he said.
Oh, right. Oh, okay. I didn't see the red light was on. Yeah, he's really got pain.
I didn't look like that. This, can you manage?
I'd love to give it to Medicare when they complain about all the shots we're doing. I'm saying, you approved the surgery, you idiot.
Yep.
Just think, if he'd have gone to the surgeon, he would have tried to do all the surgery over again.
Absolutely.
So,
Or send them to all those other therapies that don't work.
yeah, so I sent him, to put him in the hospital, and, bed rest and everything, not having a diagnosis. Okay, watch your hand there. I'm x-raying you. Trying to help me out. Oh, try to help me out.
Oh,
He's about at it, you know.
Yeah, absolutely.
you got a gun?
No, if you get those screws out, then we can fix this.
Oh, shucks.
There's another patient that has a gun that shot himself in the van, the 357 Magnum. The one with the
Who
knees.
was that?
He had the double patella. Really tall. He kept coming back as he was so excited. He's healed.
Okay, I think it's right there. It's just below your fusion. Yeah, just below.
You sure you're in the right place?
I got you all marked up, my man.
Okay.
How'd your boy do?
He's out in the ship, I think.
Yeah, he didn't do what he was said he was going to do.
I don't know, but
He said he was going to retire and he was going to
well, he got divorced.
And so he's out on the ship, huh?
I don't know, I think he's out.
How about that? That is fantastic because he was a basket case when we saw him. And we only saw him 2 days and he got his career all back.
Yeah, and he was a basket case.
Yeah, he got his career all back.
Oh, boy.
Yeah, there we go.
What show is that again? It's the show you.
Okay, it's gonna be like 3 or 4 minutes. It's still
Under the fusion?
still under the fusion. Get that?
That's it. Oh!
Don't start swearing at me, Roach.
That's fun.
I think you got it there.
Can you get up?
No.
Yeah. You need my help? Yeah, you're walking.
You know, they're gonna get it back from the insurance claim anyway.
Yeah.
You're walking a little better.
So it's,
I didn't
thank you.
get that. Dinner money.
Guy's a real gentleman, look at that,
Yes.
thank you.
You can see it, right?
Okay, where is all your pain at?
All right, so, okay, so last week you did the two injections, 4 total. And I don't know if it was too much medication for me. I'm 118 and a half pounds. I don't know if it was too much, but leaving here, you know, I had that swelling here that took a couple of days to go down. It's very sensitive. But now, in addition to the pain still shooting down the back there, I'm getting the numbness in my hand, but I'm also got pain that's very numbing, and I don't know if it's just a tightness and the muscle's not relaxed.
It's all scar tissue.
Okay.
It's all ligaments. And you have no effect from what I gave you.
No, I just, because I didn't eat, but I ate before I came today.
No, he's saying,
Oh, with all this?
No effect.
No.
And there's not that much in it either.
Oh, it wasn't?
It's enough so we don't have to do it again.
Okay.
I'm lazy like that. I want to do it the first time. All right, the arm, where's the arm bothering you?
Down right to the hands here.
Oh, it's the little finger?
Yeah.
The other one was to the thumb.
Ah, so it's changed.
This is C71. See, you thought you knew, right?
Yes, I did.
I have more tricks up my sleeve. I think you'd like that.
Oh, I don't know. I'm just miserable. It's been a tough week and trying to deal with this.
Trying to work.
I don't have enough holiday time. So, you know, in America they don't pay you for sick
Well, if
pay.
you don't work, you can get it reimbursed by your insurance company.
Again?
Of course, you had an accident.
How am I supposed to get reimbursed?
Well, I write them a note and I say you can't work.
Oh, really?
Yeah.
Oh, you can do that for me today then. I'm serious when I'm at work because of the job that I do have. When I go in first thing in the morning, I last maybe 2 hours. And then as the day goes, I'm literally going downhill.
What kind of work are you doing?
I'm a nurse
Where?
at New Vista.
Who?
You don't leave this part of the world, do you? Wellington, New Vista. Assisted
Oh, New
living.
Vista.
Yes. Have you heard of it?
Yeah. 414.
414.
And what do you do there?
I'm a nurse manager.
Okay, what do you do?
I take care of
You walk
elderly
around
people.
looking important, or
No,
you actually
I actually
work?
work.
You actually work?
I really
Oh,
work.
doggone.
I really work. Yes, I do. I start my day. I get up at 10 to 5 every day, and I don't get home sometimes till 7 o'clock in the evening.
So you're actually moving patients?
That I'm not allowed to because of this. When I went to the bone and joint for initial treatment, they wrote a prescription saying no lifting, no pushing. But how do you not do that? So when I'm there, if somebody's struggling, of course I'm going
Why didn't they
to use
take
my knee.
care of the problem so you could do that?
Hence the reason I'm here. So.
You said you had raining too, right?
No, not me. It's one of my residents actually. I'm gonna bring someone to see you. One of my residents has tinnitus so bad.
Goes out very fast.
I can't wait to see that. She's miserable. This has been all year.
You wanna see that?
I wanna see it happen.
Come in and see it.
I wanna see it happen.
It'll be on YouTube.
That's terrific.
If you can get rid of that, oh my goodness.
Yeah. Well, I did the research on it. This is the only place in the
Wow.
world that you can get rid of it.
Wow.
Because we know where it's from. It's not from the
Right.
ears.
Exactly. $4,000
Yeah.
hearing aids do nothing.
Nothing.
Well, I'll get a
That's why
card.
they don't call me and ask me how to do it.
Because they get $4,000 for hearing aids.
Oh, you put the hearing
That's
aid
why.
people out of business, that's why.
Is that?
$4,000 is cheap. Most of my residents, they pay anywhere from $5,000 and up for hearing aids. You can't help somebody's hearing come back though, can you? No.
No, it has actually nothing to do with hearing.
No, not the tinnitus, I've moved on from that.
All right, let's see. Go backwards. You don't go back. Okay, well, the new place is, this was the 5-6. Feels nice, look at that. 6-7. 71.
Ow,
There it is.
ow. That hurt.
Right on time. Oh, she's good. Okay, lay right down on your side, face the wall.
God, this is the worst bit.
I want you to face the
Did he
wall.
say lay down on my right?
Face the wall, yeah.
My head up here?
Yeah.
I had to think about that.
Gives me a little stretchability there. This is the only place you can get this done. 5, 6, 6, 7, 17. Feel that? You do feel it. Can't even get it in there, it's so hard.
Oh, God.
Turn right on over. Roll.
Where am I going?
Facing this
side.
way.
I just got to think, okay.
You just got what?
I just had to think about that, what I was doing.
Are you from Britain?
Great Britain.
Great Britain. I don't know, they haven't been great for a long time.
What do you mean?
Which part of
Ow.
Great Britain are you from?
London.
London, the big town. I visited there one time, found no Englishmen. They were all had turbans. Everybody.
That is so true. Is that it?
Yes.
God, I hate needles.
You want more?
Brian, please. No, I don't mind giving injections, I just hate getting them. Oh.
I gave him to both.
Just,
Let it go.
yeah.
So you feel a little better, feel a bit more range of motion.
She doesn't need a Band-Aid.
Thank God.
I've got a question for you. I broke my toe about 3 years ago.
Just give him a kick in it.
I tell you, it's started.
Which one? Which one?
The big one.
I'll fix it real quick.
and it's actually started to pain right in that joint now.
No, he complains every single day.
It's just a joint. You want me to fix it for you?
Step right on up.
Give him a shot in it. No, he really does complain a lot.
he
about
really-
his
Sit
toe.
up there so I don't have to bend.
I actually feel like that feels better.
Bloody shit.
Ta-da!
You look surprised.
No, I am. No, because last time it was
Talk
just.
to the camera.
It was. No,
Because
can
you
I
had
say
so
last
many
time?
places, see?
Right.
That original place is no longer there. I pushed right on.
Because I'm bending my head, I couldn't do that this morning. I'm bending down, I couldn't do that this morning.
He owes me everything.
Well, no, I really felt like something something
Please
released.
watch my shoe.
Wow.
For the
Oh
first
my
second.
God.
That's what
All right, where's the bothering you? All right,
No,
then.
serious, it felt like an elastic band just went
What
pop.
happened? I jumped. I was in a lab. I was on a ladder.
Wow.
I believe you because I've had some, you know,
And
so many things done.
I
I'm gonna
was
tell you, I hope my
pressure
weekend is a
Well,
good
where's it
one.
hurting?
It hurts.
Right here?
Yeah, when I
And the
don't wear those
injection
shoes,
sites
I
are
walk.
push it on.
tender, but
That's hurt right now.
No,
no, I can turn my neck.
it hurts when I walk.
So you
Brian?
Well, it's gotta hurt now.
Brian,
No.
I'm turning my neck.
Ouch. Yeah, that hurts.
between his toe and your neck, I don't know who to focus.
Right, yeah. Yeah, that hurts a bit. But this.
How about this?
No.
Or this?
It hurts when you bend it. When you push
Okay,
it
I'm
up.
bending it.
Yeah.
Where does it hurt? I'm not bending this, I'm bending this.
It's kind of there and
All
there.
right, I gotta use my own
I bent
instincts.
my neck.
Yeah.
Look, I couldn't do that. My neck bends.
Good.
Oh, I hope he's got the right spot. I really do. Look.
Is this going to hurt my toe?
No, it's not going to hurt. Look at this big baby.
Soccer player, you can handle it.
Gosh.
If I can handle it, you can handle it. Tennis player, soccer player.
It doesn't hurt.
One higher. And the T34 is gonna be one lower. 4-5.
Oh, in the back? Speaking French to me. Sit in the chair, sir, or is this yours?
Sit in the chair there. Slip your shirt on.
And no, I haven't surfed in a while.
Cause
Chest here.
Sir.
Yeah, that's pretty straight. What about that one?
I mean, hurt.
What are the problems with this one? T34. All right, lay right down on your side.
Sir?
That way.
Yes, sir. Oh yeah, hands with the pillow there.
On your right side. Right.
I'm sorry, I don't get much sleep lately. I slept like maybe...
No, your trouble is you don't understand English.
No. I'm actually a pretty smart guy.
I don't think so. You went to the chiropractor. You can't be too smart.
No.
Yeah.
He's passing that.
We always tell you the way it is.
What does he do? I know, I'm cool with it.
He's a spray technician, so he sprays yards and stuff.
that's kind of hard work.
Yeah, I'm certified at the Department of Agriculture. I got my licenses and everything. I'm basically a plant doctor. You got some palms out front with a boron deficiency.
So you do know your stuff.
Yeah. I'm pretty good at what I do. I was trying to get my own business and things going. Things were going pretty good. And then this happened and now I spend money instead of make it.
Yeah. I think you can get up. Hold on.
I don't know if you. He's good at it.
You know the
I
old.
want to get up. I didn't know if you were done yet or not, sir.
Did you have anything, any relief yet?
Is that right?
And then she usually comes to the studio.
Like last time, it didn't hit me immediately, but like in the evening, it was the first night I slept all night, and when I woke up in the morning, I had a lot of big difference.
Like, what couldn't you do? Is there anything that you couldn't do when you first came here today? Like maybe turn your neck,
Tell me. All right, feel good?
My
scapular, or
like
trapezius?
my traps were
tight.
Should he take the next
And I mean, they feel like they're loosening up right now.
That's good. So that's a start.
Yeah, it's like I said last time, like it didn't hit me immediately. It was like a process, like over
Yeah.
like when I got home. I don't know. Some people come in here.
No, I know.
They're like,
No, I know. It's not like that with everybody.
You know.
It is a process, and it depends how much scar tissue you have and stuff. You know. So.
But like I said, it was the best I felt, and I was stupid for doing what I did. That's
Live and learn. You know.
Yeah.
Well, we took care of the left COC one last time. That was July.
Yeah, I've been good. However,
Yeah, where's the headache now?
a week ago it started in my neck on the left side in a C pattern. You know, here, down, and then back around my shoulder. So I was nursing it, Biofreeze and ibuprofen. But then Thursday, it hit my head,
Which side?
this side.
Oh, left.
But now it's over here.
Oh, okay, right. Okay. Dina, you're so lovely. That's a nice little package.
I'm too little right now. I need about 10 pounds.
About right there.
No.
This would be COC one,
Oh.
right?
Yeah.
This would be the one we shot already. I
Okay.
can't even feel that one. Okay, it's the right. Let's do that one.
Shoot me up all over.
No. No, we just want to take care of what we need to.
Yeah. I don't want to overdo. You better cut your week back. Cut your week back.
Cut my
Work
week back.
3 days.
Work 3 days.
Yeah. Exactly.
How's the headache?
And why it doesn't, I don't feel it.
Goodbye.
You don't feel your headache?
No, I don't feel that pain anymore.
That's good.
Oh.
What a relief, huh?
I'm always here for you. Even if I have to come back from the grave, I will be here for you.
Wow, that's powerful. That is powerful. But you never had a doctor say that to you before.
I don't know if I can talk.
That's all right. You don't have to talk. The results speak for themselves.